Welcome to Everything Neuropathy with Momentum Health Neuropathy Centers. Your journey to relief, it starts here. My name is Dr. Karen May and I'm your host today for Everything Neuropathy. Please understand that I like to give great information, but this does not constitute medical advice, and you please talk with your physician, and it's for informational purposes only. So what is neuropathy? Neuropathy is a chronic condition causing people to live in chronic discomfort and pain. And there's over 100 different causes. Today we're actually going to focus on one set of causes called autoimmune neuropathy. I have lots of notes and research, so please know that I'm going to read some here too to make certain that you're getting the best information. But autoimmune neuropathy, there's a couple different subsets, but what that means is your body is breaking down and attacking your peripheral nerves. So there's an acute form of it called Guillain-Barré syndrome, and it actually has 5 subset types that need to get differentiated out. And then there's a chronic form of it called chronic inflammatory demyelinating peripheral neuropathy. And under that, there's 20 different subtypes and different other syndromes that come off of that. So there's a lot of information on this to break down exactly which subtype do you have. And so your doctors can help you down that journey. But what the chronic means is that slowly develops over time, and so the symptoms may creep up, and that which is similar to traditional peripheral neuropathy. But the Guillain-Barré being acute, it means it happens immediate, and most people are usually in the hospital because of the damage that's being done. So unlike other forms of peripheral neuropathy, the chronic and the acute form, they don't just attack the sensory nerves, they attack the motor component of the nerves and the autonomic component of the nerves. And that's what tells your heart to beat, your lungs to breathe, your belly to digest. And so we can't just think that this is just a sensory peripheral neuropathy where you're just going to get numbness and tingling, which is devastating for many, but this is different because it impacts the muscles and sometimes the organs as well, and can be pretty quickly. So there's standard treatments that are used that I think are absolutely necessary if you have have an autoimmune neuropathy, but you got to work with your doctors to determine if they're right for you. But it's called plasma exchange and also intravenous immunoglobulins. Sometimes it can be severe enough that they actually use immunosuppressants and chemotherapeutics depending on how severe the attack is and how long the attack has been going on for. But Summers and al., this is some of the researchers published in the American Journal of Epidemiology, that in their findings is that it confirms that with some autoimmune disorders, the co-occurrence of other autoimmune disorders is likely. It's not all of them, but it's likely. So if you have one autoimmune disorder and it's showing up as autoimmune neuropathy, there is probably a good chance that you have other autoimmune disorders going on that need to be teased out. And there's very well-studied, set out protocols, medical protocols to try to slow down the progression of the autoimmune neuropathies and help to slow down the destruction of the nerves as well. And I encourage you to use all medical interventions that are necessary, recommended by your physicians. However, they're still missing as to why did your body start to fight itself in the first place. And so please do not overlook that 70 to 80% of your immune system lies in your digestive tract or your guts or your small intestines. And so because it's when your body breaks down and you're now not absorbing appropriately, digesting appropriately, it sets you up for autoimmune disorders, but also other types of disorders. If you don't have good gut health, you are not going to be healthy. So it's important, if you do have an autoimmune neuropathy, to make certain you look holistically at what is going on and not just the common medication methods, which are necessary, like I said, but it's going to be very important also to set realistic expectations of what does improvement look like, depending on, is it sensory nerves, motor nerves, is it autonomic nerves? So it's important to understand that as well. So here's the thing, is regardless of the cause, you got to understand what is your body's ability to heal and repair those nerves. Is it possible? And are you breaking down internally faster than you're repairing? Because that's a problem too. And so what interventions are necessary for autoimmune neuropathy medically, but also holistically? And then can you make some changes that helps to reverse that so it slows the progression down and also starts to heal and repair at a cellular level? So it's important to understand your journey with neuropathy, where you've been, where you want to be, and then understand what the capability of your nerves is to heal, and then set realistic expectations of what does improvement look like. Because at Momentum, we go beyond the common medication method and actually focusing on healing nerve pathways. So we want to make certain it's realistic for you. So we do that by using food as medicine, try to reduce inflammation. Also getting better blood flow to the nerves is also integral, and to the organs as well. Then we can focus on actually repairing those nerves, and so you don't have to fight with the chronic tingling and numbness. So please understand that I don't know if we can help you, but understanding what your options are is also important. So you literally, all you have to do is call our office today. My team is ready and waiting to help to start to plan your relief options today. Just give us a call, 517-883-2291, and we look forward to hearing from you.